So serotonin you remove. So that's why these are when you increase the serotonin level. How do you increase? There are serotonin boosting medications like Prozac, for example. Okay. Uh, so then antifungals, antihistamines. There are different medications. Maybe from antihistamines you might know Benadryl. Can you see? And Claritin. You know it is. And antihypertensives. So these are the general medications like diuretics, beta blockers. So we saw beta blockers on top. Those that end with olol, acetyl, okay, like propranolol, metoprolol, okay, acebutolol, nadolol, okay, like that. And anti-inflammatory drugs, we have two kinds. Anti-inflammatory, what are they? Steroidal and non-steroidal. Okay, those that are steroids, you can see steroidal and non-steroidal. So the non-steroidal are called NSAID, non-steroidal anti-inflammatory drugs. What are these? These are like aspirin, ibuprofen, naproxen, Celebrex. Celebrex once it was out of the market. Now I think maybe it has returned back. Okay. Then anti-narcotics, antiviral, beta blockers. We discuss. Can you see beta blockers? All of them they end with what? All. Can you see? All, everything. So these are beta blockers. So these are the common things that you can see, and maybe it's not here like lipid reducing agents like anti-lipemic drugs. Okay, they end up with statin. Atorvastatin. Okay, like statin drugs. The other name is also statin drugs or statin medications. Statins. Can you see here? Okay, pravastatin, fluvastatin, atorvastatin. You see, all of them they are end with what? Statin. Okay, anything that ends with statin is what kind of drug? Lipid reducing drugs or fat reducing agents. That means they are given to reduce what? The fat level in the body. And another is anesthetics. If you go to anesthetics, okay, can you see procaine? All of them they end with what? Caine. Can you see? Anything that ends with caine, these are local anesthetic drugs. That means they are not so. We can classify anesthetics into two: local and general, or sometimes you can also have regional block. Local means you give the medication around only that area.
I'm doing okay. How about you?
Okay. So can you see all of them? They have what? Caine at the end. Procaine, ametocaine, okay, prilocaine, lidocaine, mepivacaine, bupivacaine, okay, like that. And general anesthetic drugs can be what? Inhaled, they can be given by mouth or intravenous IV. Okay, they can. Okay, one of them is, can you see ketamine here? Ketamine, can you see? You remember we saw it where? What kind of drug was this? Ketamine? A scheduled drug. You remember the table I gave you? Go to the table. Can you see ketamine? Schedule 3. Yeah? Yeah, that is what? You see, it's anesthetic drug. It's given intravenous. It's a scheduled drug. When it's given like for pain, it's a scheduled drug. Okay? The other is propofol. Can you see propofol? This is a very strong medication. Who knows about propofol? Okay, so basically, okay, propofol is a very strong, even it's given for animals even as an anesthetic medication. You know, Michael Jackson, he died of propofol. He was taking propofol. Yes, you know that? You don't know? Yeah.
It was 2 months ago tomorrow the world learned Michael Jackson was dead. And for the first time tonight, we now know definitively what killed him, with a chilling timeline now of the drugs Jackson was given in the final hours of his life. Late today, unsealed court records confirmed the LA coroner has concluded the pop singer died of a lethal amount of that powerful anesthetic propofol, but that drug was just one of many given to Jackson that night. And there are reports that homicide charges could be coming next. Mike Von Friend is in Los Angeles tonight to start us off. Good evening, Mike.
Good evening, David. These court documents are revealing Michael Jackson's doctor, who was with the pop star the night he died, says he was trying to wean him off of the potentially lethal pain medication. But that didn't stop the doctor from administering one last dose that the coroner now says ended Michael Jackson's life. After months of speculation, the court documents today tell the grim story of the day Jackson died. Jackson's doctor, Conrad Murray, had been treating the pop star's insomnia for weeks, experimenting with the powerful drug propofol, used to sedate patients before surgery. Murray was concerned that Jackson was becoming increasingly addicted to propofol and had used a long list of other drugs to help Jackson sleep. On the day of Jackson's death, the star once again couldn't sleep. At 1:30 a.m., Murray gives Jackson Valium. It doesn't work. At 2 a.m., Murray gives Jackson another drug, lorazepam. At 3 a.m., the doctor tries midazolam. Still, Jackson cannot sleep. Then it is still other sedatives. All fail. Then, after, quote, repeated demands, requests from Jackson, at 10:40 a.m., Dr. Murray gives him a diluted batch of propofol directly into Jackson's intravenous drip. After a few minutes of monitoring Jackson's pulse and oxygen levels, Dr. Murray says he steps out of the room to go to the bathroom. Murray then returns to the room 2 minutes later and found Jackson had stopped breathing. Frantically, he attempts to revive Jackson, performing CPR, administering drugs to reverse the effects of propofol, calling for help, but it would turn out to be too late. Michael Jackson was dead. Today's documents reveal that police questioned what Dr. Murray says he did after giving Jackson the final powerful sedative. Murray's cell phone records show 3 separate calls, one as long as 47 minutes, at around the time Murray says he was trying to revive Jackson. Dr. Murray, according to the documents, did not tell the investigators about the phone calls. The rock star reportedly referred to the drug as milk. Little did Jackson know that this would someday take his life. David?
Mike Von Friend reporting from our Los Angeles bureau tonight. Mike, thank you. And
Yeah? So that's an anesthetic drug, yes? Okay. So that's okay, that's all medications. Any questions?
Are all these generally going to be on the exam for the certification?
Yeah, really, I'm not sure which questions are on the, but I advised, to know all the book. Yeah, because how do you know? Because you don't know which one is coming, which one is not coming.
So the practice tests that we have relative to the exam, or are those based on just
No, it's just to give you how, only maybe one or two questions, but it's just a guide, not like nothing will be from there. Just to check you whether you know that or not, you know the material. Yeah? So like topical, how do you apply?
Prior to administering medications to the ears or eyes,